Hi everyone, welcome. We are starting our live PRP hair restoration demo. This is our lovely model, Peter. Peter, say hello.
Hey.
He's very excited about this. This is his third treatment. I am going to, he has his numbing cream on for about 30 minutes. I'm going to take that off, do the microneedling portion, then Dr. Z is going to come in and do the injection portion. And we actually have a lovely surprise for you today. But our lovely rep, Connie, is here to talk about the hair restoration Ducray system. Take it away.
Okay. Hi. So whenever when we're doing PRP for scalp, it's mostly for hair loss. We want to stop the hair loss. We want to regrow new follicles. So with our Ducray Healthy Hair System, it really complements the PRP therapy. It's a simple regimen that you use every day at home. So about a week after the treatment, you would start by cleansing your scalp and your hair with the Anaphase shampoo. This is really going to help to strengthen your hair. It's going to give you more volume, stronger, fuller, denser hair. It's enriched with vitamins. It's really going to help to prepare your scalp for the leave-on spray. It promotes microcirculation, and that's really what we want to do with hair loss. Whenever we have hair loss, something is getting that follicle off balance. So we start with the shampoo to prepare the scalp, and then what we're going to do is spray on the Neoptide spray. So we have a different formula for women and one for men, but this is really going to help to revitalize that follicle. We're going to increase the blood vessels around the follicle. We're going to feed nutrients to it. We're going to help support that follicle to be more in the anagen, the growth phase, and we're going to really slow down that shedding fallout phase. So the spray is really nice. It is it's not greasy or oily. I use it myself, but you want to just really spray. For women, we say about 12 pumps directly into the scalp, and you massage it in. And then for men, they have a different formula. They do about 9 pumps once a day. But it's not greasy, it's not oily. You don't have to shampoo every day. The shampoo we recommend you can daily if that's your frequency, but even if it's just 3 times a week or once or twice a week, you'll feel with this leave-on spray that you don't have to shampoo every day. And it's nice because your scalp might be a little bit damp for a minute or two, but then you can comb it through and it does not look like you have anything at all in your hair. And it smells nice too. It has a nice refresh, pleasant scent to it too, very cosmetically elegant. I'll spray a little bit on my hand. You can't really feel it, but maybe you can see it just soaks right into the skin. It's not sticky or tacky, anything like that. So that's the Neoptide spray. In the kit, you get a 3-month supply of the spray. And then when we're also talking about nourishing that hair follicle, we also want to feed nutrients internally. So we have our Anacaps Active supplements. It actually nourishes, promotes stronger hair and nails as well, so it'll help your fingernails grow. And this is a once daily supplement, and what we're doing is strengthening the keratin. We're making the hair more stronger, more resistant to shedding, falling out. It also has iron and selenium. It's rich in antioxidants. It has the B complex, including the vitamin B8, also known as biotin. So you just take 1 supplement every morning with a large glass of water. There's no animal byproducts in the formula, no aftertaste as well, so it's very easy to use. So this system on its own, we have clinical data. They've done study on over almost 2,200 patients. We have a lot of before and after pictures to show the surrounding hair is fuller, it's denser, it's thicker. This system has over 10 years of research. These are just some of the pictures that we have using the system, but when you're also combining it with the PRP injections, you're going to get much more volume and regrowth as well, so that you can have stronger, fuller hair. And if you get started now, all summer long, you're going to feel really great when you go swimming in the lakes and the pools. And even too for women, you know, we start to notice thinning in our part along our hairline. If you start now, we usually notice with the Ducray system, in a matter of weeks, you'll notice less shedding, less fallout, and then after about 2 to 3 months, you actually start to see new growth, which is very happy thing.
Awesome. Thank you so much.
You're welcome.
Thank you so much. That was so informative, and I've actually been using the women's one, and I love it. So basically what we've done over here is we spray a little iodine. We want to clean the area because a lot of times the hair has our natural oil, so we want to make sure that we're basically only injecting the PRP. Sorry, microneedling, that's the part I'm doing. And I actually think that Peter's hair looks really good like this, so we should maybe use this as his new hairstyle.
Oh, yeah.
So we've got the numbing cream on. Feel nice and numb?
Yeah.
Had it on for about 30 minutes. We've got about 11 cc's of his own lovely plasma right here. And we are just going to drizzle it in the treated area because we want to see a little hair growth right on the sides here.
Thank you.
Oh, you're welcome.
If you guys have any questions at all, feel free to ask in the comments.
It's going to feel like little scratches, okay? And I don't know if you guys were on the live from last week, but it's basically just left, right, up, down. We're creating these tiny little micro channels so that the PRP gets deep down into the hair follicles. Peter, you doing all right?
Yeah.
Sometimes the head is a little sensitive.
I feel completely numb. I don't feel a thing.
Oh, good. See, we left it on for a good amount of time then. Pinpoint bleeding is totally normal. What you can expect as the aftermath is just a little bit of erythema or redness in the area. But honestly, it'll subside after a few hours, and it gets better and better with each passing day. So you're looking at probably maybe 4 to 5 days of redness. Everyone is completely different. And we always give you the extreme option. Pardon me for 1 second. So that you might be pleasantly surprised if it's a little bit faster than that. So we did the PRP for facial rejuvenation last week, and a lot of patients were saying, well, PRP is so good for facial rejuvenation and hair restoration. Am I going to grow hair in the middle of my face if I'm a woman? No. Answer is no. But it's good for smoothing out fine lines and wrinkles, shrinking pore size, giving you that nice healthy glow. Can only stimulate hair growth in a place where it was already about to grow. Then I like to do this little punching effect where you're just, again, creating those little microcurrents. Let's go ahead and do this side. Just turn a little bit this way for me. Perfect. Make sure all of our viewers are tagging their friends. The more you tag, the more entries you get into winning a free treatment. Remember, with the free treatment, you also get the free kit that Connie was just talking about, and it's amazing.
So 1 free kit and 1 free treatment. That's amazing. So tag your friends. Each tag is an entry.
It's valued at around $900. Typically this treatment is done in a series. So we want to do these series about 4 to 7 weeks apart. You could probably do it, actually you could probably do it about 3 to 7. It's kind of like you get that snowball effect. So stimulating the hair growth, heals, and then we do it again just in time to stimulate some more. So, Peter.
Yeah?
My friend.
Yeah.
On a scale of 1 to 10, 10 being the worst pain you've ever experienced in your life, what are you at right now?
-3 or -4.
Wow, that was even better
Very
than I
comfortable.
expected you to say, actually.
This feels kind of good, actually.
Like a massage?
Yes.
Wow, look at that. Now Peter is actually a baby because he normally doesn't have a very high pain tolerance. So that just goes to show you that it's not as uncomfortable as most people think. I'm just teasing you. You're very tough. The good thing about this treatment, even if you were to just do microneedling for the face, is we can always go up into the hairline a little bit. This is a great treatment, not just for men, women as well. Connie, do you have a percentage of like what, how many adults experience chronic hair loss? It's pretty prevalent, right?
Yes. 30 million American women I know experience hair loss. And out of people who experience hair loss, 40% are women, 60% are men.
Wow.
Yes. And a lot of times, you know, I know for women, because I use the system, but when you are going through menopause, hormonal changes, they say, you know, in your 50s or 60s, you may notice more hair loss. The sooner that you act on it, the better your chance of regenerating that hair follicle. So if you're noticing thinning, don't just ignore it. And don't, you know, I don't want to say this, but don't, you know, hairdressers give a lot of advice, but stick to hairstyle and colors. When it comes to the health of your hair, it is best to see a physician. And if you come here at Zuliani Aesthetics, they're going to try to get to the root cause of your hair loss, but they're also going to help to stimulate new growth as well, too, and slow down the shedding.
Good advice.
So you want to, you know, look into it as soon as you experience loss.
Catch it early.
Yep, catch it early.
So now we are right on the top of Peter's head, and this area is actually a little more tender. So, Peter, you can be honest with us. Are you still at that -3? Or did you move up a little?
I think the numbing thing's working really well.
All right.
Why, do I look like I'm in pain?
No, I mean, I can't see your face.
He was just smiling, so I think he's good.
Like you said, it feels like a
Hi,
nice
Julie. Julie is watching. She says hello.
massage. Hi, Julie. Thanks for watching.
Hi, Julie. Am I allowed to say hello?
Of course.
Yes.
Okay.
All right, I'm going to bring it up a little bit more and down so we can get the bottom here. Look who it is.
Who's that?
Just in time.
Well, hello.
Hello.
The man of the hour. I'm going to sit up just a little bit here. Thank you. We're just finishing up on the back. He said he's at a -3 pain-wise.
Feels kind of good.
Julie, a former patient, just said, Dr. Z is wonderful.
Brings a smile to my face.
You hear that, Julie?
I want to treat this area just a little bit more.
So this is at 1.5.
1.5.
So Peter, this is your what, third treatment?
Yeah, I'm noticing a difference. It's great. Most importantly, my loved ones at home are noticing a difference too.
You always notice when someone else realizes, right?
Yes.
That syringe is ready for you, Dr. Z.
Okay,
I just don't think the top part is.
So this is our total volume.
Yes. No, I've already used some. That's
So
the
nice
rest
and
is for you.
relaxed.
You rubbed some in already?
Yes.
Okay, great. So the theory behind the microneedling is that it stimulates the stem cells in the hair. The stem cells sit in an area called the bulge of the hair follicle, and that seems to be activated with creating a zone of injury as well. In addition, it activates the platelets, which in and of themselves have growth factors in stem cells, mainly platelet-derived growth factor and epidermal growth factor. And then doing this on top of the PRP injection really sort of just boosts the healing, as well as the blood supply to the hair follicle. So the whole theory of it is to get more blood supply to the hair follicle and transition those cells or those hairs that are in their dormant stage into something called the anagen stage, which is the growth phase of the hair. And then to take those that are in the stage in which they're going to die, basically the telogen, and try and convince those hairs to get back into their proliferative state. Now the hairs on the head, every hair in your body has different growth rate and different anagen and telogen phase. The hairs on the head, you notice that the balding, which is what's called androgenic alopecia, or common balding, is there for men and women. There's a grading scale for men where the first 3 stages really involve recession of the temple or up here at the frontalis region. As you get down into more of the 4 and 5, you start to get thinning at the top of the head. And it's in these regions where PRP really works. It doesn't really work for alopecia or baldness. It's called from scarring. It doesn't. There have been mixed results with those where the balding is caused from traction, from your hair being in a ponytail or being tied back in braids. So Peter's basically the perfect candidates. Those males who are young enough where they still have thinning hair and they're at the sort of the phase of telogen, which can last up to 2 to 3 years, where the hair is actively falling out. So we want to cause that to be a dormant state. Interestingly enough, is that in the last over 10 years, there have been no FDA-approved medicines, with the exception of minoxidil or finasteride for hair loss. So we need something in between, which is going to act a little bit quicker and not have the side effects that some of those oral medications have. So this is where PRP comes in. PRP has also been used a lot in joints, in treating spine and orthopedic injuries, Achilles heel injuries, cause quicker healing. People like Peyton Manning and Tiger Woods have all had those types of injections. So I think Shalene's already put some of the topical PRP in. And these channels that she just microneedled don't stay open a very long time. So we have approximately about an hour or so, so the PRP can get in, cause there to be a vasodilation, and perhaps get these hairs to convert over into their growth phase. So in addition to this, we're going to also inject PRP into the areas in which she's been microneedled as well. So what we'll do is we'll go in and in a retrograde type fashion go deep, and then inject as we're coming out to get the PRP into the deeper regions and also superficially. Now sometimes after microneedling you may notice a little bit of hair slough where you microneedle. That's just maybe from fracturing the hair itself. Don't worry about that. It's not killing the hair follicle itself, so that can happen.
You have a question coming in from Julie. She asks, after this treatment, when can he wash his hair?
So that's a good question. I wouldn't have him wash his hair tonight. I'd have him get all those growth factors in, but tomorrow I'd have him wash his hair. Now, there's different types of hair kits as well, and what you can use in association with this. The best results when you microneedle PRP is also to put a topical minoxidil on. It's that's basically known as Rogaine. It is, you put on approximately a cc in the morning, cc at night, usually in the foam form, or there's topical liquid as well. And those 3 things, the PRP, the microneedling, and the minoxidil, has really shown a lot of hair growth. Now we do this about every 2 weeks or so in terms of the PRP to really get that hair and that vasodilation of the hair follicle going. We have to sort of prime the pump. But he should be able to shower just tomorrow. I'm going to do it tonight though. Alright, so we want to, when we inject, we're going to put in, and we're going to go for like almost every square centimeter, we're going to go in and inject.
Don't forget to tag your friends.
And you
More
put it,
tags,
and
more
you put,
entries.
and you put in very little amount, less than about half of 0.1 of a cc. So we're going deep. As you go deep, some of the hair can stimulate some of the nerves, so it can be a little bit painful. In pain, Peter?
No, so far everything's completely numb. Did I get to you in time, Dr. Zuliani?
I think you did.
Move around to the other side so I can see a little better here.
You'll see PRP will have, people will ask, is that, my PRP had rad in it, or there's all different types of tubes in which you can prepare it, so the color doesn't necessarily mean a whole lot. As long as it's mostly a golden color. Good.
Julie says, Dina says hello, Dr. Z.
The big part of, so you have to prep the skin like we did when you numb them up, and also in terms of cleaning them beforehand, before you inject. You also want to put a little betadine and wash it around. So if we can make these, it's been proven that the PRP does, there's been a lot of studies out that show that it does increase the hair follicle density per square centimeter, as well as increase the thickness of the hair shafts themselves. You notice that his scalp is bleeding. The reason why, he still has hair there, so that's good. That means that the hair follicles are still there, able to take up this PRP. If it were pure bald and no hair follicles, it wouldn't be bleeding as much.
You have a good amount of bleeding?
Yeah, a decent amount.
Should he expect any pain this evening?
Yeah, it does feel, it can get a little sore, like a headache, but there's you can take Motrin or Tylenol for that. By tomorrow morning, though, there'll be no soreness associated with it. The deeper you go, and if you go and you inject close and get close to the skull, there's a layer called the periosteum there, which is a little bit tender. That's the same, if people have ever had Botox before, they've noticed a headache, that's the same phenomenon with that. So on a Norwood classification, appears like about a 4 or 5, about a 5 probably.
Yeah. 1, 2.
I'm about a 3. Maybe I'll hop on the bed. You can do me later. All right, so we'll do up in the temporal recessions as well. Hair isn't just single strands. They come in follicular units, and that's the basis of hair transplants as well. So they come in hairs from 1 to 4 hairs in any follicular unit. In the front, you only have 1 or 2 hair follicular units. As you go further back, they're more in the 3 and the 4s. That's why you could tell the old hair transplants that look like plugs, they just put individual hairs and then stagger the hairline or put little fine hairs up front, so it looked like a straight line across, which is very noticeable. Up at the front, it can be a little more tender because there's nerves coming out of your skull that are traveling up in this region, supplying sensation to the area.
So the special that we're offering for this month is 4 treatments. How far are these spaced apart, Dr. Zuliani?
2 to 4 weeks.
And we also are including one of these kits that Connie talked about a little bit earlier. It's valued at $200 for free. So you get the Neopeptide, you get the Anaphase shampoo, and then you also get the active capsules to maintain your treatments.
There's one for women and one for men.
Yep. So it depends who wins the giveaway. We've got it all ready for you.
Come over here.
So we get the temples done. We've got about another couple cc's left. Depends on how much you use and how great of an area you use. Anywhere from, 4 to 6 cc's used per treatment.
Let's light her up.
What a trooper, Peter. Peter, you said my portion felt like a massage. Do you still think that?
This portion's a little more vigorous.
But tolerable.
Yeah, definitely.
Because you're going to do it again in another 3 to 4 weeks, right?
Exactly.
Is this your
Already have my
third?
trip planned out.
This is third. Good. For the rest, I'm going to sort of rub the rest in too. Do you put any minoxidil on now?
No, but I'm gonna go right to CVS after this and buy
After
some.
we have some here.
Yeah,
You
we
do?
do.
Hexy here.
Better than what you can find there.
So minoxidil is FDA approved It's for men and women. FDA approved for women in the 2%, and for men in 5%.
You have another question. When he sleeps tonight, will there still be any bleeding or oozing?
Usually the oozing stops after a couple hours. Maybe he'll have a little bit oozing as he's driving home. Most people wear almost like a little baseball cap or something when they get home. But after that, everything should just seal up. He may have a couple scabs here or there from the injection sites, but I wouldn't go ahead and pick those out. Just let those fall out. Another way, so people measure hair density by a variety of ways. You can take photographs of it. People do pull tests to see how much hair is staying or not. A lot of other people mix things with PRP. There's a product called Acell or Matristem, which is works in the similar factor. It just has a lot of growth factors in that. People have used that with hair transplants as well. And people will mix that with PRP. Other new things that people are mixing with PRP to stimulate it are amniotic stem cells. Mm-hmm. So these products are available now. They're made from actually C-sections. They'll put some on C-sections and take the cords, and then they will generate these amniotic cells and the stem cells. They're used a lot in wound repair for diabetic foot ulcers.
So are you just rubbing the rest of the PRP in now?
Correct. Because those holes are still open. They won't be closed for a while.
So the treatment itself takes about an hour and 15 minutes total. We do draw the blood, takes about a half an hour to spin it down, put the numbing cream on. It's fast actually, as you can see, because we basically did this whole procedure in 30 minutes. It would be a great Father's Day gift coming up. I think my dad would actually really appreciate it. So
That's
I
what I'm
might
giving my dad.
have to get him here. New hair growth. Make sure you tag your friends. We'll be announcing the winner tomorrow. Thank you so much for viewing, and stay tuned for who our winner is.
Say bye,
Thank
Dr.
you.
Z.
Bye.
Thanks, Peter.